I'm Dr. Eric Gifford with 417 Sports Medicine and Orthopedics. I've got a patient here today who happens to be my mom. So this is Virginia Gifford, and she's been having pain in her shoulder. We've actually done a couple corticosteroid injections on it. X-rays look pretty good. We're thinking it's likely some type of rotator cuff tendinopathy or impingement. And today we're going to go up a notch, and we're going to do a platelet rich plasma injection. What we're going to try to accomplish with that is just create a little bit of a regenerative response on top of the rotator cuff tendons, also in that subacromial space. If there's any impingement and inflammation between the acromion and the rotator cuff tendons, hopefully we will calm that down and also create a little healing response. So we're going to go through the process today. What we're going to utilize is we're going to draw some blood just from the arm. We're going to then place it into a vial, which we will then put in a centrifuge. We're going to spin that down, and we're going to show you this a little bit later, how we do it. So we get a concentration of platelet-rich plasma. And what that means is platelets and growth factors that, again, are part of the body's natural healing response. And then we're going to draw that out of the vial once it's spun down, and then we'll come back in and we'll do an ultrasound-guided injection into the subacromial space. So let's get started. Hey, so right now I'm just looking for some veins. She's a self-proclaimed hard stick. Apologize, I keep adjusting my mask, but I keep running my mouth too much and it keeps falling down. But ultimately we're going to make sure we find a good vein so we don't have to stick her more than once. And this is just kind of the way to locate it so that we don't have to go poking and prodding and creating a lot of pain. Okay, so basically we've now transferred the blood into the Y-cell PRP container. And after counterbalancing the centrifuge, we are now spinning it at 3,500 rounds per minute for approximately 8 minutes. And then we adjust the PRP in the Y-cell tube so that we can make sure we get the proper platelet-rich plasma that we're looking for the injection. Okay, so we're done spinning our first round of spin. Sometimes we're going to spin it more than once. What we're going to look at is our buffy coat layer. We got a few RBCs that are still settled in the upper chamber, but that's what we're going to go after from our platelet-rich plasma, basically from this line here up to the line above it. Perfect. Okay, so now we're actually done with the spin down. We've extracted our platelet-rich plasma, and we're going to go ahead and place it in the subacromial space. So what I'm looking at on ultrasound, to the untrained eye, it looks like a really fuzzy, crappy TV reception. But what we're actually looking at is the acromioclavicular joint. You can come out over the acromion, and then you start to see what looks like a bird beak appearance, and that's your supraspinatus and infraspinatus rotator cuff tendons as they insert on the greater tuberosity of the shoulder. So you can look up all those terms and get your anatomy lesson later. But ultimately, we're going to deposit the platelet-rich plasma into the subacromial space, which is right here. And you'll be seeing that needle come into view in just a minute. I've already cleaned her with some chlorhexidine prep. And you can pull that cover off for me. Thank you. Here we go. Okay, you can see my needle at that layer in between the rotator cuff tendon. Just under the acromion. We want the medication or the platelet-rich plasma to flow freely. I'm right in that space and it's flowing in very easily. I don't know if you saw it at the very end there. I'm going to save a picture of that real quick. And that's it. So a whole lot of process for a very short shot. But ultimately, we're going to hope that this really calms down some of the inflammation in that subacromial bursal area and improves that pain and function. Okay, so we're done with the injection. I'm going to throw a Band-Aid on here real quick. And again, one of the advantages of using my mom as a patient is because I get very close feedback. We see each other on a daily basis, and I'm going to be able to kind of follow, hey, how's your shoulder feel? Is it sore for the first few days? Is it feeling better after the next few days, or into those first 4 to 6 weeks is when we want to see that regenerative transformation start to take place. And we actually did a PRP injection on, I believe, one of your knees. I don't remember, it was several years ago at this point. And it took a little while, but honestly, she's been relatively pain-free in that knee ever since. And you know, that's how this medication can work. It just creates that little bit of a healing response to get you pain-free and keep you moving.